Natural remedies to fight hyperthyroidism. Hello and welcome to our channel. Today we'll try to clarify the information available online around a very specific topic: natural remedies to alleviate hyperthyroidism symptoms. According to the National Institutes of Health, about 1% of Americans aged 12 and older have hyperthyroidism. Let's start by understanding what is really going on here. The pituitary gland in our brain produces thyroid-stimulating hormone, also known as TSH, which binds to specific TSH receptors in the thyroid gland and stimulates the production of thyroid hormones. Hyperthyroidism is a condition where your thyroid gland becomes overactive. This leads to the production of excessive thyroid hormones, particularly T4 and T3. These hormones regulate your metabolism, and their overproduction can significantly accelerate bodily processes. Symptoms of hyperthyroidism can include a rapid or irregular heartbeat, unexplained weight loss despite increased appetite, anxiety, fatigue, shaky hands, heat intolerance, frequent bowel movements, or goiter. Most of these symptoms can be mistakenly self-diagnosed as depression or other conditions. Therefore, if you're experiencing these symptoms, we strongly recommend to go see a doctor. Proper diagnosis and treatment will help avoid serious complications of hyperthyroidism, such as heart problems, brittle bones, or vision issues. Common causes of hyperthyroidism include Graves' disease, overactive thyroid nodules, and thyroiditis. The main risk factor is a family history of thyroid disease and counts for about 80% of cases, followed by elevated stress levels and smoking. It's also interesting to note that females have a higher likelihood to develop this disease. Treatment options for hyperthyroidism include medicine to regulate hormone levels, radioactive iodine therapy to reduce thyroid activity, and in some cases surgery to remove part of or all of the thyroid gland. These conventional treatments are proven to be effective. However, many people seek natural remedies to complement these treatments and help manage symptoms better. Let's start with dietary changes. What you eat can significantly impact your thyroid health. First, it's essential to avoid iodine-rich foods or medicine containing iodine. Iodine is a key element in producing thyroid hormones, and high levels can make hyperthyroidism worse. Foods to avoid or limit include iodized salt, seaweed, fish, shellfish, dairy products, and processed foods containing iodized salt. It's important to note that cough syrup and some vitamin supplements may also contain iodine, so make sure to ask your medical provider before taking them. Next, let's talk about goitrogenic foods. These foods contain compounds that may lead to swelling or enlargement of the thyroid gland, called a goiter. These compounds were proven to interfere with the normal thyroid functions by decreasing the hormone production and by inhibiting the iodine uptake. Although some studies suggest these foods might be useful for people with hyperthyroidism, we advise caution in taking high quantities. Clinical data available is limited, and there is an important risk of developing hypothyroidism when combining these compounds together with antithyroid medication. Speak with your doctor about the possibility of introducing these foods into your diet in order to adjust antithyroid medication and avoid this risk. However, before completely avoiding these foods, it's important to note that research and most thyroid expert associations, such as the British Thyroid Foundation, state that goitrogenic foods are only a risk if consumed in very large quantities. As with everything, moderation is key. Goitrogenic foods include cruciferous vegetables like broccoli, cauliflower, kale, and cabbage, as well as tea, millet, peaches, strawberries, and probably the most important food for vegetarians, soy. Soybeans and soy products, such as tofu, soy milk, and edamame, are rich in protein, fiber, vitamins, and minerals. They also contain phytoestrogens, particularly isoflavones, which are plant-based compounds that can mimic estrogen in the body. Although soy does not contain iodine, some studies in animals showed that isoflavones inhibit the production of thyroid hormones and may limit the absorption of radioactive iodine and synthetic thyroid hormones. And now, let's discuss selenium. This micronutrient is crucial to the synthesis of biomolecules called selenoproteins, involved in a wide range of activities, from antioxidant function to the metabolism of thyroid hormones. Selenium is absorbed in the intestine from our diet, and the levels may vary depending not only on the food we ingest but also on the level of selenium present in the soil used to grow those plants and animals. There are many other factors that influence selenium levels in the human body. For example, vitamin E deficiency may lead to impaired ability to utilize available selenium in the body. Some vegetarian diets just don't provide an adequate daily level of selenium, and some intestinal issues, often coexisting with thyroid disease, lead to low absorption of selenium in the body. Scientists conducted various clinical studies trying to link selenium deficiency and hyperthyroidism, especially Graves' disease. However, not all achieved the expected results. It is believed, though, that taking selenium supplements along with anti-thyroid medication will help restore normal thyroid function faster. Next, let's explore herbal supplements that can help manage hyperthyroidism. Rosmarinic acid. This acid can be found as main active compound in rosemary, hence the name, but it was later on isolated from bugleweed, lemon balm, gypsywort, and many other plants from the same family. Rosmarinic acid is believed to calm excessive stimulation of the thyroid and to bind loose TSH, inactivating the ability of this hormone to stimulate thyroid hormone production. Moreover, this compound is being studied for its positive impact on specific thyroid cancer. As such, this compound was shown to improve common hyperthyroidism symptoms like palpitations, anxiety, tremor, and insomnia. Moreover, bugleweed, specifically in Graves' disease, seems to inhibit the ability of antibodies to influence the production of thyroid hormones and thus improving the symptoms of this disease. On the other hand, gypsywort extracts decreased thyroid weight and inhibited goiter progression in animals, making it a very potent medicinal plant against hyperthyroidism. These plants have been used for a long time as treatment for other ailments due to their properties. For example, bugleweed has sedative, anti-coughing, and heart-calming properties. Rosemary has antioxidant, anti-inflammatory, and anti-cancerous properties, and lemon balm was shown to be a potent antiviral and improve menstrual pain. These plants can be introduced in your daily routine in various forms, such as tincture, tea, or tablets, but make sure to consult your healthcare provider before doing so. Vitamin B1, aka thiamine. Vitamin B1 is essential for the body cells to be able to produce energy. In hyperthyroidism, the cell metabolism is highly increased, which means the body consumes vitamin B1 faster than usual. As B1 cannot be stored in the human body, vitamin B1 intake must be adjusted accordingly, in order to avoid dangerous complications such as cardiac failure. There are only a few foods rich in thiamine, such as cereals fortified with vitamin B1, pork or black beans. However, supplements are widely accessible and affordable if you're diagnosed with vitamin B1 deficiency. L-Carnitine. L-Carnitine is an amino acid normally produced by our bodies that helps turn fat into energy. It also acts like an antioxidant, neutralizing free radicals and preventing the damage they would cause. Studies showed that L-Carnitine inhibits thyroid hormone entry in the cell nuclei, thus inactivating it. This is the reason L-Carnitine may reverse and prevent overactive thyroid symptoms such as heart palpitation, tremors, or nervousness. Dietary sources of L-Carnitine are lamb meat and dairy products, asparagus, avocados, and peanut butter. Adding L-Carnitine supplements to your diet will decrease hyperthyroidism symptoms. However, it is better to consult your healthcare provider before doing so. Glucomannan. This is a water-soluble, dietary fiber derived from the root of the konjac plant. Although usually recommended for its effects on diabetes and high cholesterol levels, one study showed that taking glucomannan daily along with usual hyperthyroidism care will result in lowering thyroid hormones rapidly. Glucomannan is commonly used in foods, drinks, and cosmetics as a gelling agent and is the main ingredient in shirataki noodles. As a supplement, it can be found as a powder or capsules. Now let's discuss lifestyle modifications that can help manage hyperthyroidism. Engaging in regular physical activity helps manage symptoms by reducing anxiety and depression, improving cardiovascular health, enhancing muscle strength, and promoting better sleep. Low-impact exercises like walking, swimming, and yoga are particularly beneficial. Listen to your body and avoid overexertion. Chronic stress can exacerbate hyperthyroidism symptoms. Implementing stress management techniques is crucial for overall well-being. Effective methods include mindfulness meditation, deep breathing exercises, yoga, tai chi, and journaling. Getting sufficient rest is essential. Maintain a regular sleep schedule, create a relaxing bedtime routine, avoid caffeine and heavy meals before bedtime, and keep your sleep environment cool, dark, and quiet. Important to note, caffeine and other stimulants can worsen hyperthyroidism symptoms like palpitations and anxiety. Limiting or avoiding coffee, tea, energy drinks, and other sources of caffeine is recommended. As previously stated, stress management is vital for those with hyperthyroidism. Let's explore some techniques. Cognitive behavioral therapy, or CBT, helps individuals identify and change negative thought patterns and behaviors. It's particularly effective for managing anxiety and depression associated with hyperthyroidism. Another useful technique is acupuncture, a traditional Chinese medicine practice. Involves inserting thin needles into specific points on the body. It helps balance the body's energy flow and reduce stress and anxiety. Some studies suggest acupuncture may also support thyroid function. Aromatherapy uses essential oils to promote relaxation and well-being. Oils like lavender, chamomile, and bergamot help reduce stress and improve sleep. Use essential oils in diffusers, add them to baths, or apply them topically, diluted with a carrier oil. Progressive muscle relaxation involves tensing and then relaxing different muscle groups. It reduces physical tension and promotes relaxation. Practicing PMR regularly helps manage stress and anxiety in individuals with hyperthyroidism. Managing hyperthyroidism requires a multifaceted approach that includes dietary changes, herbal supplements, lifestyle modifications, stress management techniques, and supportive supplements. While these natural remedies can complement conventional treatments, it's essential to consult with a healthcare provider before making any significant changes to your health regimen. Thank you for watching. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and hit the notification bell so you never miss an update. Share this video with anyone who might benefit from it, and leave your questions or experiences in the comments below. We love hearing from you. Remember, taking control of your health is a journey, and every step you take brings you closer to well-being. Stay healthy and take care.